What I love about my role as a medical oncologist and as a hematologist or as a physician just in the community is to be able to interact with my patients and to be able to provide them with the resources that we have, to be able to sit down and talk with them and sit down and be able to, explain to them what's going on and in their own words and what's the best way we can provide care for them.
We treat patients going through cancer basically from diagnosis to developing a treatment plan, to supporting them through that treatment plan, all the way through follow-up and surveillance. Just act as a support, a reference, a resource to get them whatever they need, and to provide them the care that they need to get them through this time.
We have a philosophy of treating our patients like our family. So people that walk through that door are very much like our family, because what we do for our families is we go above and beyond to be able to take care of our patients.
Oncology is complex. It makes you think. It's always changing. They're coming out with new science, new research all the time. And people are surviving their diagnosis, and just the patients, they're just incredible.
When you see our patients from the day they get that diagnosis until the day, we have them ring the bell, it is super emotional. It's huge. That is a scary diagnosis. It's just life altering. And so you really get attached to these patients. We love it when they come in and they tell us about their kids, their grandkids, their dogs. And then we also are there when they're having a really rough day. We're there to encourage them, to try to lift them up, and sometimes even cry with them.
Because they're here so frequently, you get that frequent interactions with them and get to know them a little better, and they become really good friends.
You'll never find a better group of people than the patients that we have in our oncology clinic. They're strong, they're fighters, they're resilient, they're just the most amazing people. Going through the worst thing in their life, and most of them do it with a smile on their face, and they're just amazing people.
We have added so many more people to help. We've added a financial navigator, we've added additional nursing staff, we've added additional mid-level providers, we've added an additional pharmacist. So not only have we had a growth in the number of patients we're able to serve because we have more staff members, we're able to better take care of the patients.
Today we had 16 patients. Tomorrow I think we have 17 patients. So we can see a lot more patients in a day, which helps our patients, our oncology patients, with everything that they need.
During the period of what they're going through, we will support them through everything. So if there's one thing that they can do is focus on themselves, take care, focus on healing.
They've been handed this diagnosis that's kind of devastating, and then at the same time, they need to figure out how to navigate the insurance world and how to pay for it. That's one of my biggest passions, is making sure that the care is not only accessible but affordable, and helping reassure them that we'll figure it out.
Not everybody needs the same assistance, and so whether that be grant assistance with co-pay coverage or medication coverage to perhaps even premium coverage.
It's all important when we're caring for the patient. It's not only fighting the cancer itself, it's helping ease all these other strains that could potentially inhibit their ability to receive cancer care.
Enabling people to get care close to home gives them more time, gives them less time in the car, less time in waiting rooms, less time traveling, more time at home, either with their families or doing the things they love to do.
These patients, they spend, an hour waiting for labs and an hour in an appointment, and then up to eight hours for a treatment in the infusion chair. It's a long day. And then if we're gonna add travel times on top of that, that's hard. I've had 2 of my good friends go through treatment here, and I can attest how important it is to have this care close to home. It allowed not only them to have a little bit more time, but the support that they have from their friends and family to be accessible to them as well. No one wants to ride home from Spokane in the car when they're not feeling well. When you're done, you just want to be home, and you're uncomfortable, and it's invaluable to be able to just be home.
it's a lot. It's a lot on the patients. And if you can get it closer to home, it gives you a little bit more autonomy. It gives you a little bit more time with your family, and not having to spend so much time traveling for things that you could do in your own community.
Don't be afraid to call. No question is a silly question. This is the first time you're dealing with it, even if it's not the first time we're dealing with it. We're here to help you. Don't be afraid to ask for help.
Every emotion and situation that they're experiencing is real and it's valid, and I just want people to know that they matter and their situation is their own unique journey.
This might be really difficult, but you can get through, and we're here to help you. Anything you need, anything we can help with. We're just there to support the patients, is what we're there for.
Be happy. Don't stress. Just live your life like you've always been doing.
So the money that's raised from the Pink Tea and Pink Cocktail goes to the foundation at Gritman, and we utilize the foundation quite frequently to help the patients get assistance to either get a gas card to get travel here. Sometimes it's to help pay a power bill or food or groceries, and those are the things that are hard when these types of patients get this diagnosis because they can't work full-time, and it's huge. They're looking at paying some big bills, but also a loss of income. And so the assistance that comes from the foundation is invaluable to some of our patients. We've really seen the program grow, which just solidifies the fact that this program needs to be here and needs to be a part of this community.
You know, when people have to go through this disease and have to erode their savings just to dip into their savings or retirement to be able to provide for care, every little bit helps. And so whatever we collect and how much ever we do here impacts our patients. We're able to provide for services, we're able to provide for grants, we're able to provide for, you know, little things that patients can wail off when they're going through their treatment options. Every dollar is important. It doesn't matter who donates, how we donate. It's the impact that it has on the community.